The way I understand from reading your book is basically insulin resistance can be looked at on a continuum where early on, you're not going to really notice any symptoms. Symptoms, like we've talked about, are going to slowly pick up over time. And then when you've been into it even for years, that's when things like type 2 diabetes can manifest. So I'd love for you to talk on that in that continuum.
Yeah, that's part of what's so insidious about insulin resistance is that it can go clinically undetected for so long, or it masks itself as other problems. And so it doesn't go undiagnosed, it goes misdiagnosed. So in other words, the person has hypertension and infertility, and that's what they get diagnosed with. You have hypertension and infertility. And the physician could have diagnosed the person as actually just having insulin resistance, and the hypertension and the infertility were simply manifestations of the true problem. But alternatively, the problem is just kind of stewing in the background. Things are getting a little worse, but not to the level of it's on the radar of the clinician. But the relationship of insulin resistance to type 2 diabetes is one that I'm particularly passionate about highlighting, because it's a simple matter of looking at the wrong thing. Over the course of someone's life, as they're moving towards type 2 diabetes, we have two relevant variables, insulin and glucose. Over the years of this person progressing towards type 2 diabetes, the insulin has been climbing. This is insulin resistance. Elevated insulin, but normal glucose. The body just needs more insulin in order to keep the glucose in check. So this is why it goes missed, because we look at type 2 diabetes as a glucose problem. And so if the glucose levels are staying normal, well, then there's nothing to detect. However, if we looked at type 2 diabetes as an insulin problem, we would detect that much, much sooner, because you can have high insulin and normal glucose for years. And then maybe 10 or even 20 years later, now the glucose has started climbing. And again, because we have such a glucose-centric paradigm, that's when we typically detect the problem. The tragedy is even further manifested in the fact that because we look at type 2 diabetes as a glucose disease, we only care about lowering the glucose. So here we are in the state of type 2 diabetes, now elevated insulin and now elevated glucose. And so the average clinical view would say, well, let's just push the glucose down any way we can because it's a glucose disease. Again, that's the wrong view. But in order to do that, the clinician feels justified in doing whatever he or she needs to push the insulin levels up even higher. So they may put the patient on insulin therapy or drugs that produce more and stimulate the synthesis of more insulin. And now they're becoming even more hyperinsulinemic or elevated insulin. And sure, it might actually lower the glucose levels, but the tragedy, the proof is in the pudding, in that by pushing the person's glucose down, by pushing the insulin up even higher, we make them fatter and sicker and we kill them faster. That sounds very controversial. I wouldn't say it if there weren't data to support it. No clinical marker gets better when we aggressively push the insulin up to lower the glucose. Again, nothing gets better, and they are 3 times more likely to die from heart disease, and twice as likely to die from cancer, and twice as likely to develop Alzheimer's disease. Because these aren't glucose disorders. Type 2 diabetes, like all the others, are insulin disorders. Now, certainly the glucose contributes to insulin. You know, if we're putting too much glucose, I don't want to get ahead of I don't want to get ahead of myself though. So I'm not trying to say that insulin and glucose aren't related at all. But in insulin resistance, that's elevated insulin and normal glucose. It's when the glucose starts to climb because the body is so resistant to insulin. Now we typically say it's type 2 diabetic. Again, the tragedy is that we're looking at the wrong marker. If we looked at type 2 diabetes and many other disorders as problems of insulin, we would detect them sooner and treat them better.
And what I'm hearing you saying is we're not only, not treating the root of the issue, we're making things worse. We're basically treating the symptom and things are getting worse in the background.
Yeah. In fact, Jesse, here's a provocative analogy. Giving a type 2 diabetic insulin is like giving an alcoholic another glass of wine. We're giving them more of the very thing that caused the problem.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If a person's following kind of those 4 pillars, fasting, control carbs, prioritize protein, don't fear fat, they will move the needle and the insulin resistance will be gone, usually in weeks, in months perhaps.